Yes, so hello everyone, and thank you for joining us today. My name is Sophie Reyes. I'm the marketing director at Best Buy Medical. I'm very happy to welcome you today for this webinar presented in partnership with Coloplast. We are very excited today to have Vinder Nat and Natalie Kameka from Coloplast with us today. They'll be leading the presentation and sharing their expertise. Do not hesitate if you have any questions during the webinar. You can write them in the chat box and we'll answer you after. If you like more information, you can also speak with your territory manager at Best Buy Medical. Thanks again for being here, and I'll put it over to Kim Norman, the manager, channel sales at Coloplast. Have a great webinar.
Hi and welcome. Thank you from Coloplast Canada for joining us today. We are really excited to be able to share some new innovations and updates and best practice guidelines with intermittent catheterization in Canada. Thank you very much, Sophie, for the introduction, and thank you for your joint partnership with this opportunity. We're going to move on with the presentation, and today we have our clinical team specialist, Vinder Nat and Natalie Kameka, excited to present our topic of today.
Okay, so are you ready? Everybody's ready. So thank you very much and have a great webinar.
Welcome to the fundamentals of intermittent catheterization, enhancing product knowledge and improving outcomes. I'm one of your hosts. My name is Vinder, and I'm a registered nurse. I am the clinical specialist with continence care at Coloplast. And hosting this program with me is Natalie Kameka. She's also an RN, and her specialty is in wound and ostomy care with continence, and she is the clinical lead here at Coloplast Canada. Before I continue, I'll just mention that there is a disclaimer, and it is to explain that the information in this presentation is for educational purposes, and a physician should always be consulted before any decisions are made. Regarding products, please follow instructions for use that come with our packaging. So we'll just go over the agenda for this presentation, and that is to cover an introduction to Coloplast, learning the basics of intermittent catheterization, identifying features of intermittent catheters, discussing best practice guidelines, understanding what triple action coating is, and looking at SpeedyCath product range. And then finally, we'll talk about Coloplast Care Services. So with an introduction to Coloplast, our mission is guided by the company's early beginnings that started in the 1950s. It's when a nurse named Elise Sorensen thought of the first ostomy pouch. Her sister had recently had ostomy surgery, and she did not want to leave the house because she was fearful of any leakage occurring. And so what happened was Elise's idea was taken to a gentleman who was a plastics manufacturer and engineer by the name of Aj Louis Hansen. His wife also happened to be a nurse, and together they came up with the idea for the first adhesive ostomy pouching system. Coloplast was founded in 1957, and it continues to help people around the globe, including those with continence needs. So what is intermittent catheterization? Intermittent catheterization is when a sterile catheter is inserted through the urethra and into the bladder. It allows for urine to drain out of the bladder, and once the bladder is empty, the catheter is discarded. Now, catheterization may need to be done a few more times through the day, and that is all dependent on how many times a physician may recommend it. Intermittent catheterization is usually done because there's a high amount of urine still in the bladder. And this could occur from a situation where you are still able to pee, but the full amount is not discarded. And they could be due to an inability to be able to urinate. So there are cases in which we call a neurogenic bladder, where there is a brain and bladder disconnect. And this is the inability to voluntarily control urination. And what happens is the brain and spinal cord send signals through the spinal nerves. And a neurogenic bladder is a condition where the bladder function is disrupted by damage that's occurring from the nerves that are controlling the bladder. So there's an inability to urinate on your own. And typically, individuals do not sense a bladder fullness and are unable to urinate. Then we have the non-neurogenic status, which is issues that can impact urination, although they do not have anything to do with nerve damage. In this, you can see the structural problems of a urethra are involved, and the urethral stricture is a narrowing of the passageway of the urethra, and you have the false passages, which are created from an aggressive insertion of either a catheter or an instrument that can cause an indentation into the urethra and prevent urine from flowing out accurately. And then you have complications with prostate, where the prostate is so large that it's either squeezing the urethra and preventing urine from flowing out easily. It's also important to talk about the common reasons for intermittent catheterization. And first, we'll start off with the neurogenic bladder. And those are usually conditions, as I discussed, where there's a disconnect between the nerves and the bladder. And so those typically occur in spinal cord injured patients, patients with multiple sclerosis, or birth defects such as spina bifida. And we can also look at urinary retention. That's high volumes of urine remaining in the bladder due to an enlarged prostate. So again, the inability to properly urinate. Post-surgical recovery. And in that case, we're talking about perhaps an anesthetic that hasn't completely worn off, or it could be due to urinary tract or bladder surgery. And so intermittent catheterization is required as a temporary means. And strictures, as you remember from the picture, that the narrowing of the urethra and the strictures can be occur from injury or repeated urinary tract infections and an inflammation that has caused the strictures to occur in the tissue. So now that we've talked all about what a urinary retention issues and why you would require intermittent catheterization, let's get into talking about our products and intermittent catheter features. So based on the chart in front of you, you'll see that there are conditions listed on the left, and you have intermittent catheterization without problems, a spastic pelvic floor, difficulties in urethral catheterization, and anatomically speaking of the strictures, as I mentioned, and enlarged prostate. And in the next column, you'll see four different types of catheter tips. The first one being the Nelaton tip, which is a simple straight catheter tip. And it's typically used in individuals who require intermittent catheterization but don't have any anatomical issues. Next, you have the flexible tip, which it is a teardrop shape at the tip, and it's flexible, and you'll see in the image as it shows, and it can be used for any one of the conditions listed below. Then you'll see the olive tip, and that has a rounded tip to it, and it can be used for strictures or enlarged prostate, as well as the Coude or Tiemann catheter. And that particular tip has a bend to the end of it, so it has a curve to allow for passage past enlarged prostates or through strictures. So along with the catheter tips, it's also important to look at length and size. So with regard to the chart in front of you, you'll see that there is a catheter size for pediatrics and adults, and along with it, the lengths that are for each group. And for males, they should be using the male length, and females use the female length, but they are able to use the male length catheters simply because there may be issues with being able to have a close receptacle or toilet for urine to be able to drain into. And so there is that option for females to use males catheters. And then you have the funnel end of the catheter, which urine drains out from. And they're all denoted by different colors and they have different sizes, and they're usually in increments of 2. And you can see in the picture there that 8, 10, 12, 14, 16, and they can go as high as 24. But this is the most easiest way for people to identify what size they're using, and also what size needs to be provided to somebody. So Canada has its best practice recommendations, and they are available for adults who perform intermittent urethral catheterization. It's supported by best practice guidelines for nurses to understand intermittent catheterization and provide patient education. This was provided and created by a group in collaboration of nurses, agencies, the nurse specializing in wound and ostomy and continence care, the nurse continence advisors, the urology nurses of Canada, and Infection Prevention Canada. And the title of it is Intermittent Catheterization in Adults, and its best practice guidelines were set up in 2020. Also in 2020, there was the Canadian Urological Association came out with their best practice report on catheter use. And that was put out by physicians, and their emphasis was on best practices on intermittent catheterization. But the Canadian Urology Association and nursing best practice guidelines also stipulate that single-use hydrophilic pre-lubricated catheters are the best options. And why? Because there's a lower risk of UTIs, urinary tract infections. With single-use catheterization, there is the understanding that the catheter is used once and thrown away, and a new catheter is used each time for catheterization. So you minimize the risk of developing a urinary tract infection. Next would be with urethral, to prevent urethral trauma, and emphasizing that hydrophilic catheters will allow for easy and smooth insertion with minimal friction to the urethra. As a person who needs to catheterize almost 4 to 6 times a day, you want to protect the urethra. Then there's the convenience and easy use of having a hydrophilic catheter. And because of different product designs, you're able to have something with you on the go and not worry about carrying extra supplies with you, such as a lubricant or a tube of lubricant or any other kind of products that might need to be used for catheterization. And then there's also the cost effective and improvement of quality of life. With regard to hospital admissions, there can be up to $4,000, $5,000 in costs just to get a UTI treated in a hospital. And that could be a length of stay of about 4.5 days. So we want to look at making sure that UTIs are prevented and that we reduce the amount of hospital visits one person might endure. And we want to improve their quality of life by ensuring that they're using single use and that they are using a hydrophilic catheter. So again, there's minimal trauma to the urethra. Let's get into talking about that urethra. And with it, I want to speak about the triple action coating technology. It can be found on all of our catheters. And it's important to note that the coating does play a very important role in overcoming the challenges and making sure that it's protecting the urethra. Again, thinking about how many times a catheter is inserted into the bladder and then removed. You want to avoid friction, you want to avoid irritation to the urethra. And because it can be almost 2,000 times that a person will catheterize in a year. And so you want to ensure that they're using the best product available. And again, hydrophilic, single use. So just to differentiate between hydrophilic and non-coated catheters, it's important to note that the catheters are always sterile. However, with an uncoated catheter, you need to carry a sterile single-use package of gel to lubricate the catheter. And just in looking at some of them being available as polyvinyl chloride, silicone, and red rubber latex, which we need to stray away from that latex and avoid potential for an allergy to happen. And hydrophilic are ready to use. They're polymer coated catheters surface and they're sterile. They may have a sachet that you have to break in order to activate the coating, but the catheter stays smooth. It's a nice sliding insertion for minimal trauma to the urethra. And then we also need to look at the fact that not all hydrophilic catheters are the same. Some of them may have dry spots on them. And what that means is that there's not enough lubricant throughout the surface of the catheter, and it doesn't stick to the catheter as effectively as it should. The other part is that it could dry out on the catheter. So the hydration coating is lapsed, and so it becomes rough and difficult to insert, causing irritation and friction as it's being pushed into and through the urethra. So Coloplast's triple action coating technology, it creates a system where the hydrophilic coating stays bonded, stays smooth, and stays hydrated. The bonding allows for insertion and withdrawal because of the base coat, it's covalently bonded to the catheter surface, and an even coating is all along the catheter, and it allows for no dry spots to occur. The smooth surface, because it has a polymer top coat, enables excellent water absorption and low friction for smooth insertion and reduced discomfort. And that can mean a lot when you're doing intermittent catheterization several times a day. And it stays hydrated with a special water-based solution that swells the coating and makes it easily ready to use. So this video shows the insertion difference between one of our SpeediCath catheters and an uncoated catheter. The SpeediCath catheter was dipped in blue dye to demonstrate how the hydrophilic coating remains bonded to the surface and there's no residue left in the urethra, but it allows for a smooth and easy removal. So there's our insertion, and as she's slowly pulling it out, you'll see that the triple action coating remains on the blue dye and it does not come off, and therefore the urethra remains unharmed. Now this is comparing it to a self-cath. So it is a sterile catheter with no hydrophilic coating. It had to be dipped in a blue dye, and the gel was put along the catheter so it could be inserted, and you'll see that there's been some difficulty with inserting the catheter, and it is a little bit more challenging to pull it out. So you can see that it didn't allow for the coating, the gel that was applied afterwards, to stay on the catheter and allow for an easy insertion. And that can cause friction to the urethra and encourage a urinary tract infection to occur as well. So it's important to note again that a uniform hydrophilic coating can help minimize friction. And SpeedyCath coating is an advanced hydrophilic coating. There is no opportunity for dry spots to occur. And a traditional hydrophilic coating, as you can see in the picture there, leaves areas that are not properly lubricated or and leaves opportunity for irritation to occur with insertion and removal. Is the polished eyelets. And what we mean by polished eyelets is that if you run your fingers on the tip of a catheter, you will feel that it's smooth. With an unpolished eyelet, you can actually feel a little bit of an edge on the openings of those eyelets. And those eyelets allow urine to pass through them and through the rest of the catheter and draining the bladder. So it's important that you have smooth eyelets because they too have an impact on whether they can cause injury to the mucosa of the urethra with insertion and removal. And now we'll talk about our SpeedyCath product range, and Natalie will take over from here.
Great, thank you so much, Vinder. So I'm going to introduce the whole range of products available in the SpeedyCath family. So with regards to our SpeedyCath range of products, quality and safety are at the utmost importance. And all of the SpeedyCath catheters are instantly ready to use. That means once you remove the catheter from the product packaging, it is ready to be inserted into the urethra. No extra gel lubricant is required to be applied. All of the eyelets are fire polished and are covered with the same hydrophilic coating or the triple action coating technology. And this ensures as the catheter is being inserted or draining the bladder that if those tissues get sucked into those eyelets, as this can happen, that it reduces any trauma to those fragile lining of the urethra or the bladder lining. All of the SpeedyCath catheters are free of PVC, which is better for both the individual who's cathing as well as the environment. So we've divided our SpeedyCath range into 3 different categories. We have SpeedyCath Standard, SpeedyCath Flex, and SpeedyCath Compact Sets. And we will go through the different products in more detail. With regards to SpeedyCath Flex, this is an excellent product for those who prefer minimal steps for preparation due to the innovative design. It's a great option as well for those with challenging male anatomy, as well as those with normal male anatomy. So for patients that may require a coude tip, this might be an excellent alternative as well. It is discreet, offering reclosure of the packaging for removal. It's also for those who prefer a soft catheter with a dry sleeve. What we mean by dry sleeve is when you pull this catheter out of the package that it is contained in, the sleeve itself, where you can see sterile water and the catheter sit in, is completely dry, so less mess and easier to handle. It's also the recipient of the Red Dot Design Award. This is a prestigious award for excellence in innovation. And now we'll take a little bit of a closer look at the different components and parts that make up the SpeediCath Flex. I'll get my laser pointer. So starting up at the top, you can see it has this teardrop shape, flexible tip. This allows it to navigate those challenging curvatures of the male anatomy. The entire length of the catheter has triple action coating technology, making it good for smooth insertion and protection of that fragile urethra, as well as helps reduce the risk of urinary tract infections. It has a soft grip. This allows for easy, no-touch control of the catheter during catheterization. It also is a soft catheter, and this is designed for gentle, easy insertion, again, allowing it to be really flexible in navigating those bends and curves of the male anatomy. And then the sleeve that contains the fluid that helps to activate that triple action coating technology and keep it ready to use is dry as well. So much more, less messy, as well as easier to handle. So I'm going to show this video, and in this video, it's a fluoroscopy video, and you'll see a catheter. They've put dye on it so that you can follow the catheter as it's navigating through male urethral anatomy of a cadaver. So this is the hydrophilic catheter with the flexible tip, or the SpeediCath catheter. You can see it passing through that L bend here, which can sometimes be problematic, and it's making its way right into the bladder. This is the bladder neck up here, but you see that that catheter moves with ease on insertion. It's a pretty smooth insertion there. And this is a hydrophilic catheter with a coude tip. So it's struggling a little. And it's starting to actually go into what we see as a false passage over here. So again, the hydrophilic catheter with a coude tip. So as you can see from that video, when we compare the flexible tip of the SpeediCath Flex product versus another hydrophilic coude tipped catheter, that the SpeediCath Flex really easily navigates those bends and curves of the male urethral anatomy, as well as we saw the coude tip. It's more challenging to get it through those bends and curves, as well as it made its way into a false passage. And false passages can develop with traumatic catheterizations that are not smooth or easy. So the SpeediCath Flex was much more superior in that video at navigating challenging male urethral anatomy. And this is just an overview of our SpeediCath standard. This is available for those who do prefer firmer catheters. Different techniques actually help when the catheter is firmer, like the drop technique. And this catheter specifically is available in a variety of sizes, including pediatric sizes. There is a coude tip option, and there is also a adhesive dot on the other side of the package. So you would remove the paper that's covering the adhesive dot, stick the package to a wall or a table or another surface, and then you have this easy opening with the ring pull feature here to help to open the package so that even those with more poor hand dexterity can be independent with opening this product. We have the SpeediCath Compact Set. Discretion is definitely top of mind with this product. It it's about the same size, or the male one is about the same size as a toothbrush holder, like travel carrying case you might bring on vacation with you. There is an integrated sterile urine bag that is attached to the sterile catheter. And this is a great option for those who maybe don't have access to a toilet or an appropriate receptacle, or who need to measure output. I've heard of people who, when they're camping, or when they are on an airplane and don't have access to an accessible toilet and they got a long plane ride, that this product might be a great option for them as well. Also, this product can be reclosed for added discretion and easy disposal. And then we have the SpeediCath Eve. This is a female catheter, a compact catheter as well. It does have a one-step opening, so easy to open, and you can also reseal this product as well. This allows, again, for discretion of disposal. This product also does remain sterile when it is connected to a urine bag. So you can have separate urine bags. It connects to most generic urine bags, and then you can create that closed system if that is desired as well. And the SpeediCath Eve was a recipient of the Red Dot Award, again, for innovation in design. And when we take a closer look at the different features, it has an ergonomic triangular design, and this makes handling this catheter easier, even for those with poor hand dexterity. There's the easy connection point that you can connect the urine bag to, a universal urine bag. Of course, like all the SpeediCath range, it has the triple action coating technology for protection of the urethra and the reduction of UTI risk. It has the one-step opening to make it easy to handle. There is a stylish and discreet design. It really looks more like a cosmetic product, like a lip gloss or a mascara, versus a medical device. So for those with discretion and style, this can meet those needs. And it has an easy to grip handle as well. And of course, we have uncoated options. This is the Self-Cath range of products. They are 100% latex-free to reduce the risk of allergy. They have a siliconized surface for smooth insertion. They are made from flexible medical-grade PVC. And of course, like the SpeediCath range, have fire-polished eyelets, and they're offered in a variety of lengths and sizes. The Coloplast Care Program is the patient support program that we offer. So our Coloplast Care Program wants to offer more holistic support for our users with intimate healthcare needs. There are some key elements of this patient support program, and I'll go through each one. Starting with the emotional support. Coloplast has partnered with Teladoc Health to offer 3 free mental health counseling sessions. This is a third party. So when individuals are signed up for Coloplast Care, they are offered the opportunity for these 3 free 1-hour sessions. They will get paired with a mental health specialist, and they can also pick and choose who they would like to have the sessions with as well. So this is a new offering that we're proud to deliver. We also offer reimbursement and coverage support with specialists. And on the next slide that I'll show you, I will provide contact information for our designated reimbursement specialist through the Coloplast Care Program. We also offer product guidance as well as samples when required. And this phone support will be available from 9 a.m. to 5 p.m. Eastern Standard Time, where someone can call in and speak to a real person, not a robot, a real person that can help guide them through their product questions, troubleshoot common issues, and get access to other resources and samples. And then we have bunch of resources and tools. We have a designated Coloplast Care section of our website, as well as curated emails to meet the user's needs. And this is the Coloplast Care phone number and email, CAsupport@coloplast.com. So Hannah Kraus is our reimbursement specialist at Coloplast Canada. This is her contact information. You can also contact Coloplast Care to get in touch with her or your local Coloplast rep. And it's important to note that, unfortunately, Canada is one of the only developed nations in the world where intermittent catheters are not well funded. This is why the reimbursement coverage landscape is very complex and varies from province to province or territory. The paraplegia program via the Saskatchewan Aids to Independent Living has, however, been a good example of providing pretty decent catheter coverage for over 30 years. The Alberta Aids to Daily Living program has had minimal coverage over the years for catheters since the 1990s. Recently, they have significantly increased their coverage for intermittent catheters. So we are starting to see some changes. We have a position at Coloplast regarding medical affairs that does great work advocating for better coverage throughout the country for better reimbursement programs and such for intermittent catheters. So there's more work to be done. We have some good examples across Canada of some good work already done, and we will continue to advocate. For those interested to learn more, we have Coloplast Professional that you can join. There's e-learning modules, webinars, you'll get notification of any upcoming educational events, as well as newsletters. And you can visit the website coloplastprofessional.ca. You can also find us on social media. We have both myself and Vinder on there. We have brand ambassadors, so individuals who are living with intimate healthcare needs that use catheters or ostomy products are on our social media, providing their real lived experiences and tips and tricks. So a great resource for those.
So thank you very much, Vinder and Natalie. It was really interesting. And now it's time for questions. So if you have any question, don't hesitate. We'll be happy to answer you.
Some questions coming in. So here we go.
No question in the chat too. So
Yeah, I've got some here on the other end. So I know a lot of customers that carry around the catheter sometimes folding it into a small bag. Is this okay?
So no, not a great idea, especially if it's for an extended period of time. It can damage the catheter inside the packaging. So ideally, if you can carry them straight, that is the best solution or best way to manage catheters. But folding them not more than 3 hours is pretty much the standard way of recommendation.
Okay, we have another one about education. Do you have any educational how-to videos showing the catheterization technique for the other catheters?
Oh, definitely. If you go onto our Coloplast website, coloplast.com, you'll be able to view some of the videos. We have several, not just information, but videos that are great in demonstrating how and what technique to use. So there's videos that are for people who are ambulatory, and then there's videos for people who are in a wheelchair. So it'll give a great idea of how you may also want to set up things before doing your own catheterization, but also for those of you who are recommending information, the videos are available for them to your customers to be able to take a look and learn more, but also for yourselves.
Okay, I have one more that's come in. Uh, Recently, I had a customer come into the pharmacy saying that they had bleeding with catheterizing. Is that normal? What do you recommend us do?
So bleeding can be a huge concern for anybody who's starting with catheterization, and it is important to identify how much that bleeding is. There could be several reasons that that bleeding could be present, and it could be just maybe using the wrong technique, and so being a little bit more aggressive than it should be. The urethra is very, very tender. Um, but it could be medications, it could be the wrong type of catheter in terms of using a non-lubricated or not lubricating it well enough, and it could be just the wrong size as well. And so it's very, very important that you seek healthcare provider information and guidance before using a catheter.
Yeah, I agree, Natalie. And the other, sorry, Vinder. And the other thing is too, is that that's why we looked at hydrophilic catheters today to see the
Hmm.
difference in uncoated catheters, like we showed our soft cath today versus a coated catheter. The coated catheter could be something that that medical professional would recommend because there could be some trauma going on the inside. Depending on what type of catheter you're using, it's probably not, maybe might be the not appropriate technique, but also could be the inappropriate catheter, or maybe they need to be using something more higher quality.
Yep.
Okay, what other? And there's, can a urine bag be attached to a SpeediCath Flex catheter?
Yes, yes, I have actually tried it to just ensure that it can be, and it does, and it really allows for convenience. Suppose you're traveling and you're not able to get to a washroom quickly, but you do have a bag and you've got your catheter. You can insert the SpeediCath catheter, allow it to drain into the bag. So it'll give you that convenience and also that discretion as well with not having to move around too much to find a suitable space to do be able to do it.
Okay, we have a question here. Uh, it seems like the non-coated catheters hurt, question mark.
Yeah, it would hurt if it's not lubricated adequately. So there's where perhaps a review of the technique and how to utilize a catheter is really important. Um, with our SpeediCath, they're all hydrophilic, so having to worry about friction or not enough lubrication is something you don't have to worry about because the SpeediCath line have the triple action coating technology on them. So the catheter is already ready to go and insert, and there is minimal trauma because of the coating.
I think that we need to point out too is that when the gel goes on, like in that video that you showed, Vinder, that you can get dry spots too. So it doesn't give 100% coverage with just adding lubricant to a catheter. You might think because you're putting the gel on the end of the catheter and inserting it, but what happens is a lot of it, as you saw in that video, it stays on the outside. So you do end
That's
up
right.
having dry spots. With the hydrophilic and the coating being baked on in manufacturing, that coating is 100% still there going in and coming back out. So there's
Mhm.
less chance of trauma happening on the inside. We have another question here. Are the Speedy Caths covered meet the benchmark pricing of AADL? I can
Sorry,
take that one
you
if you,
okay?
yeah,
The
is
question was
that
a bit broken up. Sorry.
okay? Are the Speedy Caths catheters covered or meet the benchmark pricing on AADL?
Oh dear. Yes,
I can
I'm going to
take
let you
that
take that one, Kim.
No problem. Yes. So in we talked about different provinces having coverage, and very lucky in the province of Saskatchewan and Alberta with AEDL. For those of you across the country here not knowing what that is the pricing benchmark pricing, and SpeediCath standard is fully covered for patients that actually are consumers that actually apply for AEDL and get it. Recommendation is they apply for it through their nurse, through their home care, and then there's authorizers that actually get it. So then if they get a script from their urologist and go through, Speedy standard, yes, is definitely covered 100% for for 80%. And there's different coverages, but that's the good news in Alberta. Hope that helps. Okay, we have one other question here. What technique does Coloplast recommend for re-sterilizing catheters?
Oh dear. There is no technique. Currently, I have not come across any literature or research that has said that it's okay to sterilize a catheter and reuse it. So we don't recommend it, and it's not one of our product instructions for use. It is single use only. And again, we want to minimize a urinary tract infection from occurring. So we do not encourage reuse of catheters. And I don't know of any process to be used to sterilize a catheter. I guess there needs to be research in that, but still to date, nothing.
And just looking, oh, I think we have one more that's come in. I have clients who are not sure if they have insurance. Does Coloplast help determine if someone has insurance and what their annual limits are?
I couldn't tell you what the annual limits are. However, our Coloplast reimbursement specialist, Hannah, will be able to speak with that catheter user or their support person and delve further into the benefits program that this person is a part of, and determine what their setup is and whether and what amount that the benefits will cover. So it's very advantageous for some people to be able to connect with Hannah and find out what she has to say.
Yeah, I think you cut out a little bit. So during the
Oh,
presentation, which we'll be
sorry.
sending out the recording after, all of the references that Natalie talked about in the end, Hannah Crochet with her telephone number, if you didn't take it down, Hannah can actually help with that and do that. So we have another question here. ADL benchmark pricing for Coda catheters is only $380, which does not cover the full price for vendors, FYI. Okay, cool. And it doesn't cover the full price for vendors. I'm not sure. That could be a follow-up that we could do on with that. I do know that it depends on what type of pricing that you may have from us and different dealers and where you buy. And I know most of you in Alberta do purchase from Best Buy Medical. So if you'd like a follow-up on this question, if you could just connect after, that would be great, or your Coloplast representative, and we can go into more details on that with you so we can support you in this answer. I can even put my email in the chat there, and if somebody wants to follow up with me, that put that question in, that'd be great. So my name is Kim Norman, Manager of Channel Sales, and I'm just going to write in here in the question thread. You can see my email there. You can connect with me, and then we can do a follow-up. Okay, we have time for one last question because we're just a couple minutes over. We started a little late, just waiting for people to come on. Can SpeedyCath Flex be used by males and females?
So yeah, I'll answer that, Kim. It can be used for, it is specifically designed for males to get around those difficult anatomical issues that may be present. Um, However, it's not designed for females, but I would recommend that a female who wants to use it would speak to her healthcare provider first before subscribing to trying it. Um, However, it is designed for males, and completely up to that consultation to determine whether it should be used for a female or not.
Okay, I'm just looking to see if there's any other questions in here that I missed. Oh wait, no, I think we look like we're clear. I don't see any other questions in the chat.
All right. Well, thank you all again for attending,
Thank you very
and
much.
keep well. Enjoy the rest of the day.
Have a great day. Thank you.
Thank you. Thank you.